Understanding barriers to colorectal cancer screening, insights from patient surveys. I'm Summer Ellingson, and this is my partner, Kelly Braun, and this is our doctoral project for our Doctor of Nursing Practice degree. We were assigned a clinical agency of focus that is a federally qualified health center that has sites in both Minnesota and Wisconsin. Our clinical agency is struggling with low rates of colorectal cancer screening, despite having multiple interventions in place that are currently all happening at the same time, that are evidence-based. So they brought us in and they want us to help understand why their colorectal cancer screening rates are so low. So our objective was to identify barriers to CRC screening among this agency's patient population.
Over an 8-week period, we conducted a mixed method survey to understand the barriers to colorectal cancer screening. The survey captured patient demographics and evaluated barriers using a Likert scale and qualitative analysis. The most predominant patient was male, English-speaking, white, with some college education, an annual household income less than $25,000, and on Medicaid. We determined that the top 3 barriers included being scared of a cancer diagnosis, that screening was too expensive, and that their doctor did not advise them to get screening. Also, our qualitative themes were very similar, identifying logistical barriers, lack of awareness or understanding, fear and anxiety, their current health status being a concern, and beliefs and misconceptions.
If you want to see our survey, you can scan the QR code to our scholarly paper, and our survey is included in the appendix down there. And then if you want to see our full data set, you can scan the QR code down there too. So in conclusion, we identified several barriers to CRC screening, like Kelly said. So we recommend that the agency refine their intervention strategies to help highlight these barriers to improve their screening rates and reduce their cancer-related morbidity and mortality. To those barriers, our first recommendation is improve education on the importance and effectiveness of screening so their patients are more aware. Address cost concerns and improve awareness of current assistance because they do have a couple assistance programs in place to help with the cost, and same with transportation. And then provide reassurance and support for those fearful of a diagnosis. So the survey's results reveal a complex interplay of psychological, logistical, and financial barriers that their patients are going through that influence their patients' decisions regarding CRC screening. So we hope that the agency uses our findings to help bolster their CRC screening rates to help their patient population. Thank you for listening.